This segment is sponsored in part by One Brooklyn Health.
November is National Diabetes Month, a time when communities across the country bring attention to the disease.
So according to the State Health Department, an estimated 1.7 million New Yorkers have diabetes. Nationwide, it's the 7th leading cause of death. And while this chronic condition is becoming more common, there is so much we can do to help prevent and manage it.
That's right. Joining us now from One Brooklyn Health's Diabetes Center for Excellence is Dr. Kurt Kodroff and Janine Allen, both at the forefront of fighting this disease we call diabetes. Welcome to New York Living.
Thank you.
Good. Thank you both for being here. Now, doctor, my first question is for you. So One Brooklyn Health has just opened a state-of-the-art Diabetes Center for Excellence. Congratulations. So why is there such a need for this type of a center?
I think there's a couple reasons. I think the primary reason is the high rate of diabetes in central Brooklyn. In many of the neighborhoods in central Brooklyn, the rate can be as high as 15%. Compare that to a national rate of 10%, or in some neighborhoods in New York City, the rate is as low as 3 or 4%. So a very high rate in central Brooklyn. This is largely driven by what we call social determinants of health. Another factor is COVID-19. COVID-19 was absolutely devastating for people with diabetes who were disproportionately affected. So those two reasons, I think, are the primary drivers of establishing the center.
You know, I've since the time before time, I've heard the word diabetes. I feel like the term is thrown around a lot, but a lot of people really don't have any idea what it is. Can you explain?
Yes, so diabetes really refers to a group of disorders characterized by abnormalities in how we metabolize glucose. Glucose, or blood sugar, enters our bloodstream and it has to go into cells. Insulin is the primary hormone that functions to do that. And what insulin does is unlocks the cells so sugar can go in. In the absence of insulin, or in the presence of insulin resistance, the blood sugar rises and stacks up into the bloodstream.
Oh my goodness.
Thank you. My 49 years, now I understand.
But you're right, it is thrown around. I know there are different types. So Janine, I was wondering if you might be able to speak to some of the symptoms of diabetes.
Yes, so the signs and symptoms, regardless if you have type 1 or type 2, it's increased thirst and urination. And this happens because the kidney is overwhelmed. Because of the high levels of sugar, it pulls the water from the body tissues that's needed, and that increases our thirst and hence the frequent urination. We also have constant hunger, slow healing cuts and burns. We have reoccurring infection like bladder and vaginal infections, also gum and skin disease.
Oh my gosh.
So what are some of the tips to help prevent diabetes?
Some of the tips, I have 5 tips.
Great.
That I'll try to be as brief as I can. It's losing the excess weight, at least 5 to 7% of your body weight. That helps to lower the risk of developing type 2 diabetes. And just be intentional about moving, keeping active, at least 30 minutes, 5 days a week. Consume whole foods. Foods in its natural state, loaded with vitamins, fibers, and minerals. Eat less of the refined sugars, refined salts, and fat. And also the diabetes prevention program that engages our patients for a year to help them to make lifestyle changes, and also speak with your care team, your health coaches. They help you to navigate some of the social factors that makes it hard for these patients to cope.
Yeah. We're giggling because we load up on fruit.
We love the fruit, and we love our fiber as well.
Before each show.
Now, doctor, beside the Diabetes Center for Excellence, One Brooklyn Health also offers diabetes care at Brookdale and Interfaith Hospitals. So you're not only helping people manage diabetes, but a key component you say is education. So tell us about this community effort.
Yeah, we offer multiple access points for people in central Brooklyn to manage diabetes self-management education. As you mentioned, at Brookdale Hospital, there's a self-management program, diabetes prevention program. At Bishop Walker Clinic, at Interfaith, there's also self-management. And of course, where Janine and I hang out at Pierre Toussaint, we have a self-management program that is actually run by peers, our own patients who were trained specifically to teach people how to cope with diabetes.
That's a good tactic right there.
So how do you get screened for diabetes? Is this something that happens during your annual physical?
It's an excellent question. We screen everybody over the age of 35, but there are certain factors that would suggest we screen earlier. So people who are overweight, have hypertension, have lipid abnormalities, someone who had gestational diabetes, polycystic ovarian syndrome, living with HIV, very strong family history. There are multiple factors that would suggest that we screen earlier than age 35. And the screening is very simple. It's just a blood test called a hemoglobin A1C, which can tell us what your risk is for diabetes.
Yeah.
There we
I
go.
had one done at my last physical, and I'm A-okay
for
so
you.
far. Yeah.
Well, thank you both for being here and for sharing this very important information with us. We appreciate your
Our
time.
pleasure.
Thank you.
And if you'd like more information on diabetes or One Brooklyn Health's Diabetes Center for Excellence, scan that QR code right there on your screen or head to onebrooklynhealth.org.